Hello and welcome to this special show on Rajya Sabha Television, India's fight against COVID-19, wherein we bring you all aspects of what is being done to try and face this challenge, find solutions thrown at us in this particular pandemic. So today, we're going to talk about very important aspects. It has been quite a time since the lockdown began. All of us have followed the social distancing norms, the lockdown guidelines as well. But now it seems the time has come to reopen or restart, gradually resume our work. And to do that, we will have to learn to live with COVID-19. Now, what exactly does that mean and how can we do that? For more on this, we're joined by two distinguished guests. Let me first introduce them to you, beginning with Ms. Urvashi Prasad. She is a public policy specialist with the Niti Aayog and keeps a tab on all such policies which are being made by the government on aspects like these. We also have with us a health professional, senior one, Dr. Anil Gurtoo is the director of Lady Hardinge Medical College in New Delhi. Welcome to you as well, Dr. Gurtoo. And Urvashi, let me begin the show with you by trying to understand this concept of learning to live with COVID-19, something which has been repeatedly said. Now there is a gradual opening of different sectors happening, and perhaps starting from Monday onwards, more resumption of activity will begin. But what all needs to be done? What are the policies in place? How do we, look at this particular scenario?
Yes, I think, there's two aspects of, learning to live with COVID. And this is something the Prime Minister, also has alluded to in a lot of his recent addresses, including the most recent Mann Ki Baat address that he had done a couple of weeks ago or so. I think one is the health aspect, obviously. And, I think my other panelists will speak, a lot to the kinds of precautions that people need to continue to maintain. Because I think one thing is important, that the health challenge is not going to go away. Just because we were in lockdown and, now we've seen the lockdown getting lifted, does not mean that the virus or the epidemic goes away. That's going to stay with us. And that's true for across the world. So there's a lot of, precautions that people will have to continue to maintain. On the health side, we are continuing to gear up our infrastructure. But we are also modifying our policies based on how we are seeing the epidemic pan out. So, for instance, the health ministry, just a few weeks ago, it released a set of guidelines on treatment of those who are largely asymptomatic or mildly symptomatic, and if you can afford to be at home, then such people can actually be at home. If they have a caretaker, they can be in constant touch with health administration, then they can actually be at home. They don't need to come to hospitals, because we really need to now free up our hospital beds in many of the big urban centers where we are seeing a large volume of cases for the more serious patients and for patients who need more serious attention. So as you're seeing, a lot of the policies on the health side are also evolving depending on how this, epidemic is taking shape in the country. The other facet is the economic side, and that's where you've seen a slew of measures being announced just in the last few days to boost different sectors, right from your medium, small and micro enterprises to initiatives for migrant workers to farmers. And we will see a lot of the economic activity, as you say, open up. Some of it has already started to open up, but we'll see more. I think the principle overarching from the government side now is that while the center will provide broad guidelines, the response will ultimately then really be decided at the state and sub-state levels. Because as we know, this is not an epidemic which is uniformly spread across the country. There are certain cities which are hotspots. Just about top 10, 11 cities make up 60% of India's cases. So the response exactly will have to be determined at a more micro level. But the center will keep putting out broad guidelines on both the health and the economic side on how we can live with this disease as it evolves and as we open up.
Okay, so micro-level management based on broad guidelines being put out by various ministries and the central government as well. We'll come to specifics of how economic activity can be resumed and what all needs to be done there. But let's come to the health aspect first, the most important one here. Dr. Gurtoo, in terms of precautions need to be taken, because over this period of lockdown, there were several strict measures which were taken. People were asked to stay indoors and there were several other social distancing norms which were put in place. Now that gradual reopening will begin, people will move out of their houses. They will have to go to their workplaces. The workplaces will have specific guidelines. The public transport will have different guidelines. But in terms of health precautions, what is it that you would suggest as a health professional who has been dealing with this particular pandemic so far?
So, as you just said, there are over 100 of do's and don'ts out there on the media, policy and otherwise. So to simplify this so that we can remember it easily whenever it's required, I would simplify the entire domain, which is a vast domain of do's and don'ts, do this, don't do that, don't do that, do that, into just two principles of public health. Mm-hmm. If we remember, just everything else gets derived from these two root principles, call them core or whatever. Everything else, if we can understand these two principles, we can for ourselves on our own design our own strategies and behaviors when going out. What are they? One, hygiene. Hygiene is at two levels, personal and now once we go out, social or public. One. Mm-hmm. Two, social distancing or physical distancing, if you want it that way. Two. So these then are the two key core or root principles from which everything else flows out. What is the meaning of the word hygiene if you understand it? It simply means at both levels, individuals and when we go out at the public, civic hygiene. One, respiratory hygiene, and two, hand hygiene. Two. In respiratory hygiene, what do we mean? Only two things. Whenever we go out, we wear a cloth mask. Cloth mask. This serves the main function of wearing a cloth mask when I go out to the market or on a public transport is to decrease my transmission of virus or droplets to others. And that it does. Even a simple cloth mask, homemade, does that wonderfully well by almost 95%. It cuts down my transmitting it to you when I wear it on any public space. It can be washed at home, worn for 8 hours, washed, replaced again. Next day, it can be changed. The second thing is the coughing, sneezing etiquette. How do we cough? Normally, we just sneeze and cough out into the empty space in front of us or onto our own hands, both of which are very, very, very dangerous. So that we already know, cough it either into some tissue or a handkerchief. If you don't have that, as it often happens, just the bent elbow, cough or sneeze, but not into open space, not in your own hand palms. That's very dangerous, transmits. So this is the key. These are the two key concepts about respiratory hygiene. Mask, cough etiquette. No third. The second key concept is what we call social or physical distancing, which means only one thing: maintain 1 to 2 meters, 3 to 6 feet, or an arm's length, 2 arms length distance between you and everyone else, whether to your side, front, or back, everywhere. That has to be. So you just see yourself, imagine yourself in a bubble, trapped in a bubble with 1 meter radiating out of you as spokes, and you're moving. And enforce it aggressively. And there's no need to be apologetic if you say, please, I don't mean it. However, to protect you from me, if nothing else, please, 1 meter, 2 meters. And these are the only two which have to be enforced at the personal level, at the public level, at home, in families, and when going out to civic spaces or the society or the community. Okay. These are the only two principles. Every do and don't flows out of these two: hygiene, social, and hand. Hand meaning hand washing, because please remember that most of the transmission that is occurring now, even in our healthcare centers, and I'm looking after the COVID ward here, most transmission is not occurring through droplets. Those. Why? Because we are already protected. We are overly protected about, aware about the fact that we have to protect and wear the mask. Okay. Where it is coming now, the new cases are through hand. I'm wearing a full set PPE, N95, this and that. But what I forget is that it creates a false sense of complacency, a safety, which is false. And while taking it out or during the process, I touch inadvertently, reflexly, my hand, which has been touched to some contaminated surface, which is everywhere, to my nose, or from the mask to the nose. Or while I'm removing the mask, I touch my nose. So it's hand to nose, which is becoming a key factor in transmission now, because mask awareness is already set in, and it's very easy to wear a mask and say, look, I'm protected. Where we forget is the hand. So respiratory, hand, and the second concept was social distancing, 1 to 2 meters, 3 to 6 feet. If these two principles are remembered, no trouble will come to us. If we don't,
okay. Dr. Gurtoo, you put it very simply, that these are the two core principles, and pretty worthy to remember them as well in terms of the social distancing norms, maintaining a distance of 3 to 6 feet, and also the respiratory etiquettes or personal hygiene, which you pointed out. Let me go to Urvashi now. Urvashi, if you look at these two core principles, obviously on the outside, it would look like that this is obviously a person's responsibility, a common citizen's responsibility to go ahead and enforce these. But now that gradual reopening will happen, there will have to be some norms in place, guidelines in place. Some of them are already there in terms of the workplaces which are opening gradually. But overall, generally, if you look at it, how do you see that these two principles, core principles, be implemented very effectively in public places? Because now people will start moving out.
Yeah, I think, so as I said, that a lot of the broad guidelines the center has been putting out and will keep revising. I think one thing to note in this is that what might be said today, might not be as valid 1 week, 2 weeks down the line. So
it's a dynamic situation.
Yes, you'll keep having certain revisions, and I understand it's at times confusing for the common citizen, because you say there's so many guidelines coming out, but unfortunately the nature of this epidemic is such that it has been evolving, it has been changing all throughout. So I think one thing we'll have to be very careful is our absolute hotspot areas. Because now even the red zones are being defined at a much more micro level, even within the sort of red zones. So like even Delhi, if you look at Delhi at a very large level, you can say most of Delhi is in the red. But even within Delhi, there would be certain pockets which are much more hotspots. So if you are resuming economic activity, you have to be very careful that in these areas you will need an extremely cautious approach. Whereas if you're doing it in areas where you don't have, as much of an issue with the disease, it's obviously much easier there. But certain protocols have to be followed uniformly. So if in your factory a worker, for instance, unfortunately contracts this disease, you have to follow all the disinfection protocols that the government has put out. In fact, in some of the government buildings, unfortunately, recently we've had a few cases, and we've gone through all those disinfection protocols. We've gone through, mandatory closing of, even if not the entire building, but a certain section of the building, for a certain number of days till it's again considered safe for people to come back. So very similar things will need to be followed in other offices, in factories. I think the ultimate onus and accountability, if you're an employer, you will have to take, while there will be the guidelines, but everything, it's very difficult for the center to keep enforcing or keep checking that are you doing this or not. So somewhere I think even for, those who are running these businesses, running these factories, there's a lot of accountability there as well. So there is individual accountability, but there's also institutional accountability to, follow these sort of norms and guidelines that the center puts out. But I think in any case, in the very sort of high concentration zones where we have a large caseload, I think the resumption will be quite slow, will be quite gradual. It should be. I mean, I think, again, that is something which is down to states and even, city governments to take a final call on in terms of the extent to which they want to allow relaxations. But I think we have to be very, very cautious because, anywhere in the world where the cases went down, in some places we are seeing a resurgence. We are seeing a second wave. So we cannot get complacent. Yes, we have to resume our life. We have to resume economic activity. We have a very informal economy. So we cannot let our poor people, suffer. They've already suffered a lot, I think, on to the lockdown and other issues. So obviously we need to balance that out. but it has to be in a very calibrated manner. Otherwise, if we see another big spike or another big wave, it could again lead to a heavy-handed lockdown, and we don't want to go back to that. We don't want to keep doing those kind of flip-flops.
Okay.
So I think the accountability, I would say, is institutional as well as individual.
Okay. On the institutional accountability and precautions which need to be taken at the institutional level or workplaces or public places, Dr. Gurtoo, from your point of view, those two were the core principles as far as personal hygiene, social distancing to be maintained by individuals are concerned. But when it comes to institutions, now that the workplaces will open gradually. Public places will open gradually, perhaps public transport. There will be specific guidelines for that as well when that happens. But from your point of view, from a health professional's point of view, what might be the key core principles there?
Let me begin at the beginning. Your topic is learning to live with COVID. So I pick up the key word here, one of the key words, learning. And I'll use this concept of learning to develop the institutional level, what should we do and how should we do it. Learning is ultimately what? It is change. Learning is about change. Changing what? Changing behavior. So the learning for changing our behavior before and after COVID and lockdowns. Before and after learning has to change. Now, with this, I would define this whole process into, let us say, 4 domains. Mm-hmm. One, the most important, attitude. Attitude as an individual trait and as an organizational cultural trait. Every organization has a social culture. Attitude, 1, 2, cognitive or knowledge structures, such as those 2 principles. Those are the only 2 knowledge structures that are important. Everything can be derived from them. Mm-hmm. 3, behavior, change our behaviors. And 4th, the most important, long-term, culture. Mm-hmm. So attitude-wise, when I as an individual will enter my office on Monday, post-lockdown, my attitude has to be different from what it was 5 weeks ago. It has to be. What would that attitude be? I have to see myself as a change leader, which means I don't wait for my office head to tell me, do this, don't do that, spit there, don't spit there, what others are doing, don't bother about that. I have to see myself as a transformed person, as a change leader, which means everyone a leader. Mm-hmm. Leader of what? COVID, public health responsibility, as Dr. Urvashi said, responsibility and accountability. So one change that we all have to have in ourselves when we step into our offices, that each one of us has to see ourselves as a change leader vis-a-vis this public issues about 2 things: social distancing, are they being maintained or not everywhere? And 2, hygiene, hand and respiratory, is it being followed or not? Mm-hmm. I don't wait. I take a proactive approach and I say, look, you are doing that. It's okay. It was okay earlier. Now it is not. Do it for my sake. If not, some respectful messaging has to go out from all of us because things take time to change. The mm-hmm. second attitude will have to be realistically positive in our attitude. Positivism alone will lead us to overconfidence and disasters. Realistically mm-hmm. positive. That is, we have to accept the reality as it is and not as we wish it be. Reality is, this is here to stay for a long, long time. It will not go away soon. We might even have another wave. A third might also follow if we are going by the 1918 model, historic model. Mm-hmm. So it is here to stay. Accept that. So if this stays, if I change, we all stay alive. If this stays, and I believe it will go off tomorrow, so what? I have lived all my life. Mm-hmm. I go, it stays. So okay. This is the second. The second thing is the knowledge, which only 2 things have to be remembered: hygiene and social distancing. Hand hygiene, respiratory hygiene, no third. Everything has to be derived from this every day, workout as part of leadership. Third is the behavior. Now, all this knowledge has to be transformed into day-to-day behaviors at office, which is only again 2, washing the hands before and after, not touching our hands to our face and nose, which is the deadliest of the problems now confronting us, and wearing a cloth mask, 8 hours change, can be reused. Okay. Social distancing. The last thing is the culture. Now, all this matters nothing if it remains in my head as knowledge, or it remains between me and the three of us as behavior. It will still not make a difference. We have to transform this into cultures which have to be disseminated across organizations, families, and societies. That is my job. That is my responsibility. That is our collective accountability and responsibility. And that is all I think I would say in terms of learning to change.
Okay, that again is a very apt sum up out there. Behavioral change and passing on the knowledge, the learning, the idea that we will have to bring that change in that post-COVID scenario as well. Concluding comments from you there, Urvashi, on what we've done so far and what needs to be done from here onwards. It is indeed a Herculean task, and all of us are the stakeholders here.
Yes, absolutely. I think, from the government's perspective, there's obviously a lot, as I said, we've done on the health system preparedness. That has to continue because we also have to, not neglect our other diseases, our other health issues. I think one of the other things, we'll have to balance out is that, months ahead, we might see outbreaks of, dengue, of chikungunya, of malaria. We have a lot of other issues. We have people with cancer, we have TB patients. So we have to balance things out even on the health side. And I think that's where the health system, will now have to move towards, that we can't have only a single focus on COVID. We also have to balance it with other health issues and health needs of the people. So I think that's what's going to happen on the health sort of policy side. The other is on the economic side, as you said, whether it's, public transport, whether it's factories. We're going to have many things starting up. They've already started up in small ways in many places. But it'll have to be carefully calibrated. It'll have to maintain, the different norms and protocols that will be put out. If we have the metro operational, for instance, we'll need a separate set of protocols just for the metro in Delhi. How does it run? How do we clean it? How do we disinfect it? So I think everything will have to be done at a very micro level. The center will continue to give the broad sort of guidelines, the broad protocols, but then their actual implementation, adherence, and modification as needed, as per the local context, will come from the states and even at a sub-state level from the districts and from the cities. And I think finally, I would just say that, yes, I completely agree with Doctor here that this is going to eventually be a behavior change, a culture change for much of the world. And also for us, I think, the way we've thought of life before COVID, it is going to be different now. But I think there's also a lot of positives we can take from it, like the focus on public health, on hygiene, and making it a very integral part of our lives, not just thinking that we'll do it during a pandemic. These are things we should always do. Hand hygiene is something we should always maintain. So I think that's a great positive that should come out in this new normal of, living with COVID.
Definitely. And these positives should stay with us for longer. One more aspect before we bring this to and close, Dr. Gurtoo, and that is that when we say we will have to learn to live with COVID and the COVID-19 is here to stay for some time, this obviously gives rise to fear in some minds, and that's natural as well. So what would you suggest to dispel that particular fear? We've spoken about how personal hygiene is important, how institutional mechanism will have to be put in place and steps will have to be taken. But to dispel that fear that, yes, everything is not as it was maybe 6 weeks ago, but we can overcome this if we stay together and all of us are stakeholders.
Fear, yeah. So what I think, fear has to be dealt. Fear is an emotion. It is a negative emotion that arises under circumstances of uncertainty and unpredictability as it is. However, to begin with your key word, learning, the way to handle fear is to develop new learning, which we have learned, and certainly a lot has changed over the past 5 weeks. Mm-hmm. One, we have learned, even you take precautions, take all those two principle approach-based precautions. Even in spite of that, if you catch COVID, so what? Just look at the statistics, what we have learned over the past 5 weeks. It doesn't kill. The fear makes us assume that it's a death sentence. COVID means death sentence because we have seen the images come out of New York and Italy and all, and those images have been anchored as stories into our minds. And those anchored stories generate a perception. That perception does not match with the Indian realities. The gap between the perception and the Indian reality is creating a lot of panic. Let us learn. The learning here is that Indian realities are a bit different, at least until now. And that realities are shaped by two things. Yes, it is very contagious. It is very infectious. You just don't know how it comes and when it comes. But it doesn't kill us as much as it has in other countries. Look at it. In my own hospital, there's just one person on ventilator out of so many admitted. In the whole of Delhi, there wouldn't be more than 5-6 on ventilator with more than 20 million population. So it has weakened in terms of its capacity to kill or destroy my life, though it is very contagious. So take precautions. If you catch it, it's not a death sentence. Follow the guidelines of the government. It will be cured.
Okay.
This is at the individual level. However, the problem is coming. This virus is also creating a social contagion, apart from the biological contagion. And people to people, a lot of stigma, stereotypes are spreading very fast, faster than the virus. So that has to be dealt. And that is what I said in my leadership. The first attitude is that of a personal leader. Now, I have the knowledge. I know Indian realities are far, far more benign and not as bad as we had expected earlier. It is not that. So I must play a leadership role when I see someone peddling or transmitting false, fake news or into a stigmatizing behavior or discriminating behavior. So I must assert my leadership. Each one of us must do that. So realistically positive, that is the attitude, a learning attitude, and that is how we can handle fear.
Okay. A positive attitude and a learning attitude is what will help us tide this situation. Thank you so much, Dr. Gurtoo out there, and Urvashi, you too as well, for your views on how to learn to live with COVID-19. As our panelists have pointed out, the key here lies in obviously attitudes and attributes like personal hygiene, focusing on social distancing norms, and obviously institutional mechanism or guidelines which will be put in place at workplaces at different kind of levels as well. Micromanagement at local level is something which is the key, as Urvashi was saying, but we will have to be the change agent of change, which we want to see, as in the change makers, as Dr. Gurtoo said, and all of us are stakeholders in this fight against COVID-19. Keep watching Rajya Sabha television. We will keep on bringing you all the sector-wise aspects from here onwards as to what are the guidelines for different sectors like public transport, industry, restaurants, workplaces, and we'll keep bringing you update information on what needs to be done and what needs to be stayed away from. Keep watching Rajya Sabha television, keep following the social guidelines and the other norms which are being put in place by various governments, be it the central, state level or the local level governments. Thank you once again.